This project, Let's Grow Together, a 3-year project, is looking at ways of training caregivers, preschool teachers, to be more inclusive of children with disabilities, particularly in early childhood education. The ORLO grant allowed us to investigate an underexplored area around early childhood development, school readiness and disability in a low-resource country such as Malawi. What we did was to develop an inclusive, disability-friendly training package in a rural district in southern Malawi. We worked with the Social Welfare Office and the Education Office to look at ways of improving access for children with disabilities. The project was focusing on a 2-week training program for all caregivers so that they could then try those new practices out with children.
In Malawi, we have about 32,000 caregivers working in various community-based child centers, but only half have been trained because training caregivers is really expensive. We contributed towards increasing capacity building in terms of number of caregivers who have been trained to support children in Malawi. Issues of special needs and inclusive education has been included in their training manual so that each and every caregiver who is now going to attend training is using a manual which has the content which we developed in Tikuleli Modzi.
We visited a number of parents after the project to find out how their children were getting on since they enrolled at the centres. And in many cases, the children had made improvements. Some had developed more language and communication. Those who were really shy were making friends. The parents felt less embarrassed about having a child with a disability. There was greater exposure. Communities were more interested in these children. We partnered with a non-government organisation called Sightsavers. It was really key for them to be part of this project, and since then they have been developing new projects on early childhood development in Malawi and in Kenya. We also worked with Anthropologica, with the University of Malawi, but importantly we worked with the Ministry of Gender, Children, Disability, who oversaw the project.
We've seen that children with disabilities were able to grasp a lot of concepts in class because we adopted the inclusive approaches. We were using colorful teaching materials so that children with low vision should be included and those with intellectual disabilities as well. The research project brought in a number of lessons that Malawi Country Office adopted. They looked at issues of interaction, issues of involving parents of children with disabilities to be involved in taking care of their children, teaching of children through plays, through songs. All those things were adopted from the ECD research.
One other change is that the University of Malawi Chancellor College has developed a Bachelor of Education degree on early childhood development and education with a component on disability or special education. These are the real significant partnerships, and as a result, each partner has actually gone off and made changes themselves.